Madaga yorere.
Okay. I was very confused that time.
Madaga yorere diye.
So I used to get confused, and I used to feel dizzy, and I used to sometimes fell down.
Markasa banang be manangka manimo ilidu nang fonyang and be often gift.
And sometimes I can even like walk down the stairs, go outside by myself, and while my wife is sleeping in the house without even knowing I left the house, I fell outside there, and then they will take me to the emergency room. So they will send an ambulance, they will just send me to the hospital.
Kawai hadda markii oo isbitaalkan usoo galiyo lugtan faraha lakusoo gooy aad iyo aada hadda ida uroon horay ida an qasanaay hadda qof in reewa siya in weelan dadka maasha Allah wal kasta la ila socda waxaan shirinin qoyto la ila socda marka hadda markii aan shaqana boo anago niiday degantiya soo shaqaysay manankay ku sanaaday ugul ana sidii shaqeeyo isli kalba ogayn ana ba qatar ahay hadda aad iyo aada marka mahadnaqaa ilaha mahadninka leh maasha Allah marka iidani aawiyan familkanay Thank you.
Thank you very much.
You're welcome.
Yes, it was different because they gave me more support.
You're talking with Lori and the staff about how you're feeling, and if you get anxious, you're talking to people. You're not just calling 911 immediately.
Yes, Lori don't want me to. She don't want me to feel like I'm having anxiety attacks. Because that's what when I was at home, with the other place, I was like, I was nervous all the time.
And now you're not.
No.
So now you have a little extra support here at the Erie program, and they help to prepare you for your appointments.
When they first came here, they checked up on me, but now I think I'm doing all right.
See, what happened to me is I got smashed in the head. Nobody hit me in the brass knuckles. I had a traumatic brain injury. I lost my job. I was making great money and this and that. My life went down the tubes. I've been to the hospital probably 50 to 60 times, probably within the 5-year period, if not more. I use the emergency room as basically like a place, I guess you can say, to go and hide and try to get my anxiety medication. But the thing is, it wasn't like you just can't go to the hospital and get, here's your medication, and that's not what it was about. It was actually being able to talk to people that would help. And that's where the program set in, where, you have case managers, you have people that actually, do you need a ride, do you need food, do you need this, do you need that? And they would help, tremendously, while other people didn't really realize, what to do. And I'm like, look, this is what, you can get. When I got rides, I had people bring me food. I've had, you know, just everything compared to being just thrown out on the street with a piece of paper. It doesn't work. It won't work that way. The new lofts that I live at, it's beautiful. It's unbelievable. They have their own gym, laundry room, just everything that you need to survive. But they never really gave up. They always gave you a game plan afterwards. That was the main thing. Visit this, do this with the doctor, do this and that, and it helped. It really did, as long as you followed it. Sometimes, a couple times I didn't. Where I wound up was right back in the hospital. You can't just depend on, in other words, them doing everything for you. You have to do your own thing. The whole team's helped me to actually keep myself alive. Make yourself feel like, all right, I can do this, I can get through this, I can try to do that, I can do this again. And it really does. It makes a difference in the world. Because a lot of people don't know that. They just have to stay on the streets. But I'm just very, very thankful. It actually makes you want to live instead of go out on the street, hurt yourself, do things like that. Because it's like having faith in something. I've gone from being in the hospital probably 4 times trying to commit suicide, which I failed upon, to having some people, not only just Vicky, but just it's just the whole team itself saved my life.